Hello, my name is Dr. Nicholas Tarola, board-certified plastic surgeon and owner of Tarola Plastic Surgery in the Nashville area of Tennessee. Today I'm going to answer a question from a real self patient who is inquiring on the need to separate a breast implant removal procedure from a breast lift procedure. In the case of breast implants, whether they're being replaced or removed, there's been a pocket created underneath the breast tissue and or the muscle, which has to some degree compromised the blood supply to the breast and the breast skin. So in the case of a patient who has very little breast tissue to start, and that pocket or plane has been created, if you perform a breast lift at the same time as breast implant removal or replacement, you could further compromise the blood supply to the skin and therefore increase the chance of poor wound healing or actually some skin dying. So in some cases it is recommended to separate procedures. Also, in the case of breast implant removal, it may be recommended to either remove the implants, or if there are saline implants in place, to first deflate the saline implants several weeks to a couple months before the ultimate removal and breast lift. This allows for the skin to naturally contract or shrink down to possibly the state that the skin was in prior to the augmentation to begin with, or at least to some significant degree, so that when the breast lift is ultimately done, less skin actually needs to be removed. And in some cases, actually, once the skin has been allowed to contract for several weeks, it may turn out that the patient doesn't actually need a breast lift after all. So as you see, it can be rather complex making these decisions and how to best guide a patient toward surgery and what procedures may be necessary. So I'd recommend always deferring to your plastic surgeon, who's had the advantage of examining you and who knows your history more than any other doctor who's just answering a question on the Real Self site. However, just as with any other consultation, if you have any hesitation or question, sometimes it is recommended to seek a second opinion. So I hope this information has been somewhat helpful to you, and please don't stop asking questions. Thank you very much.